Hello there, modern man. In today's episode, I have a special guest, Dr. Carolyn DeLucia. She is a world renowned OBGYN, vagina guru, and widely published author and worldwide speaker, and also a very good friend, but an excellent doctor. And today, we're going to dive deep into the female pleasure system, and it will be a learning experience for me, and I hope it'll be a learning experience for you, because this is a channel, sexual health for men, but we need to know about the female pleasure system and how it goes, because it's actually more complex than we think. So today we're going to learn from Dr. DeLucia on what we need to know about the female pleasure system. Welcome, Carolyn. I am so glad you are here in our channel. And there's your cat in the
Or
camera. I
otherwise
love
known
it.
as my pussycat.
Your other known as your pussycat. Lovely, lovely, lovely. That's a good introduction to cat as the pussycat.
There
So
we go.
let's just dive deep into it. Now, what is your experience of men being knowledgeable about the female intimacy, pleasure, orgasm system?
Well, I think that the basics are communication. And every partner, any good man wants to please his woman. And it's a sense of connection. And it really, in any good partner, it brings him huge satisfaction and his own personal arousal when he has pleased his woman. So, as far as any male understanding the female intimate nature, it just takes communication and two ways. We are talking to the women too, in being open with their men to help really know how to please each other.
Okay, so that's a big word, how to please each other. Both you and I treat sexual dysfunction for both men and women.
Yes.
And oftentimes it is almost like there's a lot of miscommunication. Almost like you have to kind of teach the anatomy again. So, what does a man need to know about getting a female to pleasure?
Absolutely. A lot. They've got to learn a lot. Wait a minute. Let me find my clitoris. Wait, where is it? Oh, here it is.
You had me there.
This is a model of the female clitoris. And what I really want to show is the full anatomy. There's a lot more. This is the little tip of the clitoris that we can see in female anatomy. But behind the scenes, there's a whole lot more. And what this shows to men is that beyond the tip of our clitoris, which, by the way, has 8 to 10,000 nerve endings
Mm.
versus the analogous head of a penis that holds 4,000 nerve endings. I'm going to pause there for a second. You know why? Because you did hear me correctly. The clitoris has 8 to 10,000 nerve endings, and the head of a penis has 4,000. So, gentlemen, the clitoris is very, very sensitive, and it does govern a woman's sexual response. But beyond the tip, there's the full length of the analogous structures, which are the crura and the vestibular bulbs. The vestibular bulbs are very similar to the prostate gland, and they
Mm.
open up right next to this would be the urethra in this area here. And this is where the vaginal opening would be. So the urethra has two tiny little openings right next to it
Mm.
that are the Skene's glands, that are the opening of our vestibular bulbs, which are actually going to secrete some form of what would be similar to an ejaculate when a woman is appropriately aroused and reaches orgasm. That's different than vaginal lubrication. Vaginal lubrication is from increased blood flow to the area with arousal that then allows secretions into the full vaginal vault. And all of this takes place with intimacy and with appropriate arousal techniques. And that's different woman to woman, partner to partner, and it's how the two of you interact and learn from each other.
I love that, and it's individualized, but there's also some time discrepancy. How long does it take a woman to be aroused compared to a man?
Well, it can vary quite a bit, but it does take, on average, around 10 minutes to do the whole arousal stage, which is otherwise colloquially known as foreplay. And sometimes it takes 24 hours, which means it starts in the morning, which means it begins with a cup of coffee and, and how you treat that woman all day long. So a woman is not as easy as a switch. So if in all sincerity, if there's been an argument in the day and it has not been appropriately resolved, a woman is not going to be a sexy pussycat in the evening. That has to be resolved as part of the foreplay. And then the strict foreplay in the bedroom is that arousal period of which you speak, in, which is the stimulation of the tip of the clitoris, which then allows the entire area to be infused with blood. Gentlemen, this clitoris area here is analogous to the full shaft of the penis, and
Mm.
women get engorged and erect just like a man. And that requires blood flow. And that blood flow requires appropriate arousal. Some women like it soft. Some women like it aroused in circles. Some women like it up and down. And there's nothing wrong with asking, babe, do you like it this way? Do you like it this way? Do you like it a little bit of both? Do you like it firm? Do you like it soft? It's how that touch is required per that woman and what it takes to get the nerves and the blood flowing.
Okay, so does every woman need to have clitoral stimulation? What about like vaginal stimulation?
Okay, that's a very delicate question. And what most of us in this realm, this educated in sexual therapy, believe is that, in all sincerity, even stimulation at the G spot, which would be in this area inside the vagina, below the urethra, in the midline, somewhere about 1 to 4 centimeters in on a vaginal wall, will be the G spot. Every single woman has a G spot. Some of the understanding nowadays is that it's sort of an extension of the clitoris in
Mm.
the realm of the urethra, soft tissue that surrounds that area in the vagina, giving it more sensation. I will say every single woman has this anatomical region. Some find it an erogenous zone, some don't, much like kissing the nape of the neck or stimulating the nipples. Some women, you can play with their nipples all day long, it doesn't arouse them. Some women, you can kiss their neck up and down, it doesn't arouse them. Some go nuts, right? You just touch their neck and they are aroused, excited, and just ready to move on. Other women, it doesn't. So, is it their erogenous zone? If the G spot in the anterior wall is an erogenous zone, then vaginal stimulation and appropriate stretch of the vaginal vault with penetration of the penis will stimulate that area and allow for arousal and or a vaginal orgasm. My understanding, my downright personal experience, let's face it, is that with the appropriate fit, which is the size of the penis, the angle of penetration, with an appropriate foreplay. So we are talking now, if you've heard all the stipulations, the sun, the moon, the stars, the planets, all aligning in the perfect circumstances which occur 20% of women, meaning 80% of the time, that alignment is not going to happen, then
Mm.
a vaginal orgasm is pretty special. But
Mm.
with all the perfect alignment and communication, vaginal orgasms are very possible.
Yeah, what you're saying is like that vaginal orgasm are not as frequent or easy as clitoral
Exactly.
orgasm, right? And I myself totally agree with that. Maybe too much TMI, but I think the vaginal orgasm for me is probably very little compared to that as well. So because you had everything has to align, like you said, the pressure, the
Exactly.
size, the lubrication.
The
So
moment, everything, I
uh-huh.
feel. And that's tricky. There are very few women who have vaginal orgasms every time. The key, even then, is that the clitoris is involved. That's the bottom line. And again, if you're noticing this entire anatomy, the vagina wraps around it. No matter what, vaginal penetration involves having the entire clitoris involved, no matter how you shape it. So, when
Mm,
this is pulled appropriately, the tip comes down, gets stimulated with penetration. I don't mean to be so graphic, but I think it's making a point. If
mhm.
you know what I'm saying?
Yeah.
And that's what's going on. No matter how you shape it, the clitoris is going to be involved.
Mm. So the clitoris really kind of wrap around the vaginal,
Yes,
the top and on the side.
that's correct. So, this entire anatomy, this is the vagina overlapping it. Does
Mm.
that make sense?
Mhm. So what's the role of the vestibular bulb? The funny looking like
These
legs there.
areas
Yeah.
here hold blood flow and secretions and help women to ejaculate. Now, Ejaculation and squirting are not necessarily the same thing. Women will always ejaculate, which will be a small amount of fluid coming from the Skene's glands. Some women have abundant fluid coming from the Skene's glands and the urethra. Some of those secretions, when analyzed in clinical data, have shown not to be urine at all. They are very chemically identical to the secretions from a prostate gland. So they are truly ejaculate, as in a male. Everything about a female is analogous to the male.
So the vestibule gland, does it secrete PSA because it's like analogous to the
Yes,
prostate?
yes,
Oh, so she can secrete. She can
yes.
also have a PSA level as well too.
Well, I don't know if we don't measure women's PSA, but that's an interesting question. I don't know if that's ever been asked, Dan.
I know. See, maybe somebody should look into that because
We
you
may
said
have
it is
to.
analogous to the prostate gland.
Yes. Oh, there's no doubt about it.
Yeah, it's analogous to the prostate gland. When you mentioned that it's almost the same chemical
Yes.
as the
Prostate.
prostate fluid without
Yes.
the sperm, of course,
Yes.
then there's got to be some PSA. Just that's
Oh,
what my first thought I have there, and
I never
maybe
tested it. I've never looked at it. And I love these kinds of questions that come up because looking at hormone therapy, we can talk in depth about metabolites and measuring those in men and women and the dangers of those. So these are questions that come up from us thinking and discussing these things.
I so appreciate you showing us the anatomy because the anatomy, 98% of the female anatomy is hidden,
That's
right? Especially
correct.
the clitoris. The clitoris.
Exactly. Depicting, allowing them to see that this is the tip and this is where the vagina opening would be, and everything else is behind the scenes and arousable. What this means is that these crura that hide along the side of the vaginal labia, the space between the labia minora and labia majora, are also very, very sensually arousable and often ignored. So, the area between the labia is a very sensitive and sensual area to engage.
So, guys, listen to this. Take note. So, women have two labia, the labia majora, which is the bigger area, and then there's a smaller one called labia minora, more often referred to as the lips, but the space
Yes,
between there, that's where the crura is at,
yes,
right?
that's
Yeah.
correct. Just getting through my book, I'm trying to find the one and only picture I have in the book, which is the external female genitalia, because so much is not understood. And men, you're not alone. Women don't understand their own anatomy. Trust me, I'm a gynecologist and I have to show women what's what down there too. So it's just helpful to understand the labia majora versus the labia minora versus the Skene's glands versus the Bartholin's gland openings, all different areas of our very intricate anatomy.
Right. So, what's the role of the Bartholin glands? Which show us where the Bartholin glands are at.
The Bartholin's glands are way down here. They secrete a teeny weeny bit of a mucousy type of discharge. They are not the same as vaginal lubrication. Vaginal lubrication is what we in the scientific world called an exudate, which is a secretion from the entire length of the vagina. It's a moisture that comes out from the full length of the vaginal vault, from the blood flow to the area. So when women become menopausal, meaning not making estrogen anymore, we lose our estrogenic support to the blood flow to the vaginal vault. What that means is without estrogen, over time, the tissues of the vagina continuously change and thin out and dry out. So, gentlemen, I want you to understand your women that when we are menopausal and not treated, because Dr. Ann will treat your women as well to make sure that they can maintain their blood flow to the vagina, and that will enable them to lubricate. But if not, it feels like having sex with a cactus.
Mm,
I'm not joking. It will feel horrible, like a hairbrush, the bristles of a hairbrush.
mm,
And it
mm,
becomes agonizing. That is not pleasant, and they will try to avoid it. Pretend they're asleep, tell you to go elsewhere. They don't mean either. They're just in so much discomfort, they can't even emotionally go
mm,
there. I saw a 73-year-old woman today, and it broke my heart because she came to me and said, "Finally, I found you. For the past 10 to 15 years, I've been asking my gynecologist to help me with my ability to tolerate intercourse. I can't tolerate it. I no longer want it because I fear the pain. But I love my husband and I want to get back to that intimacy." But my doctor kept on telling me, "Oh, forget about it. You're past all that." That's not right. There's no need for us to
mm,
ever be past all that if we as partners are not at the same place. In other words, if Dr. Truong has treated you successfully to maintain your erections and be able to enjoy intimacy, if it's on your own, then allow her to treat your partner and make her able to enjoy this intimate moment together. Right?
Absolutely. One of my passion for the men is that painful intercourse for a woman in menopause should not happen. It is reversible,
Yes.
easily correctable with
Yes.
just a topical or even a lubricant. It can even be non-hormonal, just a topical hormone that will actually reverse it within
Yes.
days, right? I mean, I see my patient feeling better within 3 to 5 days with just some topical estrogen, with some DHEA, and
Yes.
even non-hormonal using platelet-rich plasma to just bring in more blood flow, more lubrication to the area. But no woman should be suffering from sandpaper or intercourse. You feel like a hairbrush brushing against there. It should
Right.
not be uncomfortable. It's correctable. So, guys, if you're listening to this, tell your partner, tell somebody you know that is in menopause. Usually, women in menopause ranges between even as late as early as mid 40 to even 60 is the range. Menopause means that they're not having their period anymore for 1 year. But oftentimes, women don't realize that. They don't realize that their hormones is what changes in the hormones is what is causing the discomfort. Oftentimes, unfortunately, they blame themselves, right? And
Yes.
yeah, they
Yes.
blame themselves for having the pain. It's like they don't know what they don't know. And they're like, well, I guess must be getting old. My body's not liking sex anymore. So I just have to accept that, right?
No, don't accept it. And it doesn't have to be that way. Similar to how gentlemen should never think that it's necessary to experience erectile dysfunction. We have so many solutions for the treatment of erectile dysfunction, as we have treatments for any of the vaginal issues women encounter. The vaginal dryness and discomfort with sex is the only symptom of menopause that gets worse over time if untreated, compared to any other symptom. The hot flashes, the night sweats, the terrible mood swings, all of those mellow out despite any treatment. However, vaginal discomfort atrophy, as we call it, which is the continual change in the tissues, will get worse if unaddressed over time, making it more and more impossible to endure vaginal penetration. And eventually, the pain is enough to turn off any desire because they're so afraid of the pain. They don't want you to even touch that super sensitive tip of the clitoris anymore because they're afraid of where it might lead, and they don't even want to have an orgasm anymore. Imagine that. How unnecessary that any of us should have to go through life loving our partner and unable to engage in intimacy.
Oh, yes. And in fact, Dr. DeLucia wrote 2 books. The first one is Ultimate Intimacy,
Yep, there
right?
it is.
There you go, and you can find that on Amazon.
Yep,
And I'll put the link to her book in the episode description. The second book is Ultimate Connection.
yes.
There you go, and I'll put that link as well too, and that's one of her many books, and take it from her, she knows, because she we are both very passionate about treating sexual health because we know that is a big component of intimacy and relationship. Okay, modern men, you are not alone and you don't have to suffer anymore. ED can feel isolating, frustrating, and even defeating. The endless guessing, the quiet shame, the weight of not feeling like yourself. It's exhausting, but here's the truth. You are not broken. You are not alone. You don't have to figure this out alone anymore. The Get Wood Now Boost program is your step by step path to sexual confidence and restoration. No more suffering in silence. No more trial and error. Just real solution, real result, and the confidence you deserve. It's time to take back your power on your term. Let's get this journey started together. Check out the course at getwoodnow.com. I'll see you there. I just want to backtrack a little bit. And you said earlier that ejaculate and squirting are different. What is the difference?
Okay, so squirting is an involuntary excretion of abundant fluid coming from the skenes and urethra in women. And that women cannot control or stop, but it's abundant, typically more than just a few drops. Every woman an orgasm will be secreting something from the Skene's glands. And if you actually, during a really strong orgasm, if a woman feels either side of the urethra, you can feel a pulsation going on in that area. And that is just like an ejaculation in a male.
So it comes from the same orifice, same opening.
That's correct.
And squirting is just more volume,
That's correct.
but the same fluid.
Yes, very similar.
Very similar. Now, does all women squirt?
All women have the potential to squirt. Yes. With appropriate arousal and enough stimulation, of that anterior wall of the vagina. As a matter of fact, a friend of ours, Dr. Charles Runnels, has written a book on guiding women just how to make that happen. So we
Right.
would refer them there.
Exactly, and I'll link that book too. It's also on Amazon as well. So, having said that, and I've actually learned something, and you've explained it so well, and between the Bartholin glands and the skin glands. And if
Yes,
I learned something, imagine our men. How I mean, just looking at the anatomy, you show the vulva, everybody, that's a familiar thing, but a lot of the anatomy is really behind
that's
the
correct.
labia. How
That's
can I guess the man has to kinda know the anatomy and get your book and follow along,
absolutely.
practice.
Practice makes perfect.
That's right. So, what advice do you have to our listeners who are 98% men on how to arouse and get their woman to that orgasmic state?
The biggest thing is to pay attention to her body language. And I believe that women will show signs. If men, she's laying there like a lox, doing nothing, something must not be happening. Now, I'm going to say that the woman has to be present, meaning that mentally and physically, she has to be willing to be a participant. But if she is and she loves you, then when you begin to see her moving along with your advances and her body is responding, then you know that you are doing the correct thing. And when she postures more as if she is getting closer to that orgasmic level, with maybe the head back, the eyes closing, all of those signs, you know you're right on the right path. And keep doing what you're doing. Don't stop. Don't stop. And hopefully, she's willing to communicate back to you how well you're doing. I do understand that for women, when we are stimulating our man and there's success in that, that we have an outward sign from you. Obviously, there's an obvious ejaculate, and that is a sign to us that we have accomplished what we have been seeking. And for gentlemen, there isn't as obvious a sign from their woman. But when she is truly involved and present and responding to you, it's hard to fake it. You know the difference once you've been with a woman long enough.
And if you were going to talk about the erogenous zone for women, let's just kind of teach our men now to be the Casanova. Let's hit the erogenous zone. Let's get the woman kind of in the mood and ready. What would be those steps?
Okay, so I think the very first step. Now, some women like you to be approaching the genitalia right away, but some women don't mind a little gentle touch, which every bit of our body is truly exogenous zone. So, even starting at the temples and rubbing the temples and just relaxing her, rubbing her forehead, working your way down. And you can judge if they're ready for you to touch more intimate areas, meaning the breast, and working your way down to the genitalia. But you have to be the connoisseur of your own woman and understand what steps she's ready for. Should she be ready for clitoral stimulation? As I mentioned earlier, don't be shy to try to understand what type of touch she needs. A simple question: do you like it firm? Do you like it gentle? What helps you more? And Those types of communications in that moment show you care, like my little doggy, not so little.
in,
He's
in
joining.
in the camera. First we have your cat, now we have your dog.
Thank goodness it's not my 19 chickens. But
That's coming up. That's coming up, right? Oh, yeah, that's what makes it so fun. You never know what shows up when you're talking
that's right.
Carolyn. Yeah. Yeah, yeah, for dog now on this. So we're definitely gonna keep that in
He was
the
a little
podcast.
nosy.
That's what the fun part about that. All right, so listen to your women, ask her what she would like. Every
Yes,
woman is different.
indeed.
And every woman is unique and go slow. And I heard from you in the beginning of our discussion was that foreplay could even take 24 hours at the
You got
beginning
it.
of the day.
You got it. We're not a switch. We're not easy to turn on and off.
Right, right. We're not a switch. We're not easy to turn off. I kind of also hear from you is that you got the vaginal lubrication.
Yes.
Then you also have the ejaculate as
Yes.
well. So there's a lot of fluid and lubrication going on.
Yes, absolutely. And if it ever feels like the friction, sometimes gentlemen like penetration, maybe before a woman is quite ready. In that scenario, the next step is to definitely use a lubricant. Don't be shy about that. Absolutely not. And there are wonderful lubricants on the market. One of my favorite is Uber Lube, and it's
Hmm.
very nice consistency, disappears after quite a, it's very comfortable and not messy. And with that, it's a wonderful way to ease comfort with penetration and not make it uncomfortable should that friction be required for longer than the woman is able to naturally maintain. Sometimes, as gentlemen get older, they have what we call delayed ejaculate, and there's nothing wrong with that. And certainly, as a loving partner, you don't mind being involved for the longer period of time as long as it's comfortable for both of you. So a little lubricant goes a long way.
Right. I love that. And I also recommend Uberloop, and we'll also put that link for Uberloop as well. I want to touch briefly on when we were talking about a very serious subject that you and I are very passionate about is that discomfort with intercourse for women, which is treatable. So for the listeners that are listening to this, what are some treatment that are available for women to get rid of that sandpaper feeling, that
Yes.
discomfort feeling that they can go talk to their doctor and get treatment for?
The number one standard of care in the gynecological world is local estrogen or local DHEA. Both of there are several products on the market that are FDA approved and covered by insurance that will at least be able to be used locally. However, are they my favorite? No, because we have to balance the dose with systemic absorption. So, some women would require a lot higher dose than what actually would help their tissues in order to achieve that success. So, then it might get into their bloodstream, which is not desired. So, when that happens, women, despite the use of the local hormone, may still be uncomfortable. That's when all of the non traditional treatments offered by doctors like myself, which would be functional gynecologists, regenerative gynecologists, aesthetic gynecologists. We have many names these days, but we have alternative therapies such as low intensity extracorporeal shockwave, lasers, either CO2 or erbium. We have radio frequency painless devices that can treat the tissues, as well as all the regenerative procedures, such as PRP, exosomes, etc., protein concentrate. There are many evolutions of regenerative procedures these days that we can use to replenish the blood supply and integrity of the tissues.
Absolutely. First, topical, DHEA and estrogen. Well, estrogen, you can't get that over the counter. It has
No,
to
no,
be,
no, these are
right?
prescription. They're
Yeah,
all
they're
even the DHEA suppositories are prescription in the United States for the vagina.
exactly. So you have to kind of go see your gynecologist, but not all gynecologists do hormones.
Right.
Right. So that's kind of the discrepancy there too. So you have to kind of go see like a functional gynecologist or what you were saying, regenerative medicine gynecologist and discuss this with them, which is make things more complicated for women. It's hard enough as it
Absolutely.
is. And then you go see a gynecologist who's not comfortable with hormones or is familiar with it, and that person may say, "You don't need it, you're too old," or not important anymore, and really downplay your symptoms. And so you have to kind of be an advocate for yourself and your health. And I know that Dr. DeLucia and I will agree on this, that we believe that you can have sexual activity to the day you die. You
Amen.
don't have to give it up as you get older. And that is a myth that we were taught, in the 1700s. We are now in 2025. That is no longer true. You can still enjoy sexual activity with everything to the day you die. Because now we have technology to replenish the blood flow down in the genitalia to make it function again as if you were in your 30s again, but you don't have to worry about all the contraception part as
That's the plus, right? So,
yeah.
yep, we are very similar in age and we practice what we preach as far as maintaining our own health and our own longevity. It's more than just sex, it's about our ability to live our lives to the fullest and to the best of our capabilities overall. Intimacy is, of course, a very critical part of that.
And having said that, I want to ask you two things. What is ultimate intimacy and what is ultimate connection? Can you explain that to us?
Ultimate intimacy is just my way of saying be your best intimate partner. Intimacy has a range of meaning. It can mean meeting you where you are. It means if, let's say, you are well into your 80s and at this point there are clinical reasons why actually having penetrating intercourse is no longer the priority, but maybe cuddling is. If that's how
Mm.
you define your ultimate intimacy, that's a way of maintaining that ultimate connection. Ultimate connection is really learning, number one, love yourself, and number two, then you can love others. So when it comes to the ultimate connection, you've got to connect with yourself first and then others. And it takes some learning and sometimes maturity to be able to overlook your own faults, overlook noise in your head, and come to the realization that maybe you're not so bad and maybe someone else can love you too.
Oh, I love that. Make sure men and the women listening to this get her book. I will link that in the description, Ultimate Intimacy and Ultimate Connection, because I think that once you read that, it will be an easier way for you to talk to your partner. Because I noticed that the one of the most challenges that my men face is that how to talk to their partner openly to have them understand that sexual intercourse is important for them. Even inside, I saw a 79-year-old male today who lost his wife a year ago. and wants to get back to dating again. And he wants to be able to have intercourse. He has ED for the past 10 years, but he wants to get back in the game. And I love that. And I think that is so sweet. It definitely is possible. And we're going to do everything we can to get him functioning again. But that's really kind of the minority, right? Because sometimes people will say, well, you're 79. What do you want thinking about having sexual activity? So, having said that, I'm so grateful that you here with us in this episode, teaching us about the female pleasure system. And women, I hope you learned something. I've learned something. Men, please listen to this at least 3 times. Get her book, because it's oftentimes it knowing your partner better than she even knows herself is really the way to her heart. And is that, what do you say about
I love that. Perfect.
so how can our listener find out more about you to work with you?
Oh, well, on Instagram, I'm simply Carolyn DeLucia, MD, and you could certainly follow me there and private message me if you do need to. And I'm happy to answer your questions. My office website is drcarolyndelucia.com. I try to not make this complicated. And you could always reach out for me there and tried to reach the office. My office phone number directly is 908 431 5849. I'm in New Jersey and Manhattan.
And she's not only an excellent doctor, she's also a good person as well. She's beautiful on the outside, beautiful on the inside. I've known her for a very long time, and just I'm very grateful for our friendship and just, sharing our same interests together. And we always laugh when we're together. She always surprised me. I never know what to expect from you. We have the clitoris, we have your cat, we have your dog. Well, now we're missing the chicken right now.
Oh, and I do have an incredible man. Let's not
Oh,
forget him.
that's right, and she's getting married soon,
Yes,
right?
I am. Yep.
Congratulations on
Thank you.
that.
Thank
Yeah, and I hope to meet him one day as well. So reach out to Dr. Carolyn if you're in New Jersey and in Manhattan. And having said that, guys, I hope that we have given you some tips, the female and how to arouse her, and that know about
Good
the
tip.
clitoris. That's right. Know about the clitoris, and you may even know more than your partner, which is awesome. So we will see you in the next episode.
Thank you.
Thank you. Okay, modern men, you are not alone and you don't have to suffer anymore. ED can feel isolating, frustrating, and even defeating. The endless guessing, the quiet shame, the weight of not feeling like yourself is exhausting. But here's the truth: you are not broken, you are not alone, and you don't have to figure this out alone anymore. The Get Wood Now Boost program is your step-by-step path to sexual confidence and restoration. No more suffering in silence, no more trial and error, just real solution, real result, and the confidence you deserve. It's time to take back your power on your term. Let's get this journey started together. Check out the course at getwoodnow.com. I'll see you there.